Maybe you had cataract surgery 5 years ago, 20 years ago, or maybe just a few months ago. But lately you've been noticing some familiar symptoms. So you go to your eye doctor and they tell you have a secondary cataract. And you're thinking, excuse me? Are they growing back? Am I going to have cataract surgery again? I think it's fair to say that most eye care providers don't necessarily approve of the term secondary cataracts because of the confusion it tends to cause. You already had cataract surgery, and in that process, the natural lens was removed. Cataracts happen when proteins clump together in the natural lens. So you don't have a natural lens with those clumping proteins anymore. What you do have in the eye is a synthetic lens that doesn't have proteins and is incapable of developing a cataract. So thankfully, no, the cataract is not growing back. So I'm sure you're wondering, if the cataract didn't grow back, then what's going on here? Well, let's clear some things up for you. Before I get into the treatments, I want to tell you a little bit about how cataract surgery is done so you can have a better picture of what's really going on here. The lens isn't just hanging out loose inside the eye like in my model here. It's actually surrounded by something called the capsular bag, which is very, very thin. And during the surgery, the capsular bag, pretend it's surrounding my lens here, a hole is made in the front of the capsular bag. The lens is broken up into pieces so it can be removed, and the new lens implant is placed inside of this bag. So the entire back part of the bag remains, and then the peripheral part of the anterior portion of the capsule remains as well. This helps to hold the lens in place and separate the front part of the eye from the back. Because this capsule remains in the eye, cells can begin to grow and migrate along the posterior part of the capsule, and the capsule can sometimes contract as well. And both of these things contribute to the capsule becoming slightly opaque, and trying to see through that feels similar to looking through a cataract, and that's why it's called a secondary cataract. But the true name for it is Posterior Capsular Opacification, or PCO. The timing of the development of a PCO is highly variable, though most people start to notice symptoms between 2 months to the first 5 years after cataract surgery, though some people may not get a PCO at all. The biggest symptoms to look out for are blurry vision, halos or glare around lights, so usually more trouble with night driving, and more difficulty with near tasks. So the question is a PCO preventable or reversible? Well, the answer really is no. A laser can be used, however, to treat it in a very quick procedure. And I know you may be thinking, you're never supposed to point lasers at your eyes. Why would you do that on purpose? That sounds really dangerous. Well, okay, true, in the real world you should never point a laser at your eye, but this is in a controlled environment and the laser is being used by a trained physician and it's being pointed at this very specific and small area, the posterior capsule, which is very far away from the retina, which is the area that you're worried about being damaged by a laser. If the laser isn't focused precisely in the right area, it can damage the lens implant, which we'll talk about soon. I'm happy to report that the treatment for a PCO is much simpler and quicker than the treatment for cataracts. And many eye care providers even have a laser in their office. This procedure can be done by ophthalmologists or by optometrists in some states. We'll talk more about the prep and post-procedure monitoring, which takes the most of the time, but the procedure itself happens in only a few minutes. It's painless and there are immediate results. The approach for the procedure itself is pretty variable, but in general, your vision will be checked prior to the procedure, your eye pressure will be checked as well, the eyes are usually dilated, a numbing drop is applied to the eye, and sometimes an eye pressure lowering drop is applied as well, though at times this is put in after the procedure. What's also remarkable about this procedure is that since a laser is used to focus on that particular area, there is no cutting into the eye, there's no external wound. The laser is used to focus on that posterior or back part of that capsule, and a hole is cut in that capsule to clear out that clouded area. Now, I know I talked about this capsule being an important part that's left in during the cataract surgery because it helps to separate the front from the back of the eye and stabilize the lens. But once the lens implant has been stabilized for a few months, it is okay to take out the center of this posterior capsule, and remember that the anterior periphery of the capsule is still in place, as well as the posterior periphery of this capsule. And the front and back of the eye are still separated by that lens implant and these capsule edges together. There are typically two kinds of lenses that a provider would use to do this procedure, and this lens is a contact lens, so the eye is numbed so that this lens can be touched to the surface of the eye, and that helps the patient to keep their eye open, which keeps them safe during the procedure, and this lens also helps to focus the light during the procedure. The post-procedure monitoring is also highly variable between providers. Some may have you wait in the office for an hour and check your eye pressure at that point to make sure there was no eye pressure spike. Some may not. Some may instill a eye pressure lowering eye drop after the procedure, or some might have done that already prior to the procedure. The reason that's done is because the eye pressure can spike because you're adding energy to the eye with this laser. We'll talk more about those complications soon. Some providers may prescribe anti-inflammatory drops to use following the procedure for about a week or so, and an eye pressure lowering eye drop may be prescribed temporarily if the eye pressure did happen to spike during the procedure. Usually there's a follow-up within 1 week to 1 month after the procedure. The vision will be checked, glasses prescriptions will be determined if needed. The eyes may or may not be dilated to check the retina. The doctor will go over if you've been having any symptoms and how things are going, and they'll check the eye pressure then as well. One of the most common complications of a capsulotomy is floaters, and these tend to be temporary and decrease slowly over the weeks to months following the procedure. These occur because this capsular bag is still within the eye, and so it's going to be floating around in the back portion of the eye, but it will eventually settle and it doesn't cause issues from there. Another somewhat common complication is a spike in eye pressure, which we've discussed a little bit. It's more worrisome in those who have glaucoma or ocular hypertension, but fortunately it's pretty easily managed by eye pressure lowering drops that are used on a temporary basis. This is also why an eye pressure lowering drop may be instilled before or after the procedure. Another fairly common complication is pitting of the intraocular lens implant, where the surface of the lens is damaged slightly by the laser. But fortunately, this isn't often an issue because of the way that the hole is cut, which is in the periphery of the capsule. So there shouldn't be any pits in the central area, which is responsible for that clear and sharp vision. So it's usually not an issue. Sometimes the intraocular lens can shift a little bit during the procedure, but this also doesn't typically cause any changes to vision. And if it does, maybe a mild glasses prescription may need to be prescribed following the procedure. There are other more rare complications that could occur with a capsulotomy, but I personally haven't seen any of these post-operatively, and those would be retinal detachment, which would usually be more common in someone with high myopia or somebody who is already at risk for a retinal detachment, a posterior vitreous detachment, macular edema, corneal edema, or uveitis. We've already covered that cataracts can't grow back, but can a PCO? Well, rarely. I've only seen this a few times, but fortunately, a capsulotomy can be repeated. If you've been diagnosed with a secondary cataract, not to worry. The treatment is minimally invasive with rare complications that require treatment. You should always discuss risks versus benefits with your provider and whether you have any risk factors that could make some of these complications more likely, and use that to help to guide your decision. I hope this video cleared some things up for you. Thanks for watching, and I'll see you next time.